We're here with Mirabelle today. So Mirabelle, how pregnant are you?
So I'll be 40 weeks in 3 days.
3 days. So
yeah.
You're due on Monday.
So I'm due on Monday.
Brilliant.
Yeah.
So tell us a little bit about the pregnancy.
So it's my third pregnancy and it's been a great pregnancy. We had a very smooth beginning. I always get quite a bit of nausea the first 3 to 4 months and feel very tired, but then it stopped. And I had that for my first two, so it wasn't a big surprise.
Right.
And then between 4 and 9 months, I'm always feeling great and feeling very active and not too tired. And apart from a cold or the other, it's been a beautiful experience feeling the baby grow.
Fantastic.
So, yeah.
And during the sort of middle to later stages, you had a few things go on with the scans. Do you want to just explain to people what happened?
Yeah, so when I was 6 months pregnant, we had one of the checkup scans, and the scan showed that there was some small problems with the kidneys. There was a bit too much liquid in the kidneys, so they asked us to come back. Then when we went back 2 months later, probably the person who scanned me wasn't very experienced, and she told me that there was a problem with some ventricles in the brain, and that might mean that the baby was terribly in a bad state and we should have an MRI scan right away. And then I came back and another doctor scanned me and there was nothing wrong. So for 24 hours it was a bad day and a bad night. But all along, I mean, once we knew everything was fine, we were very happy, but still a bit stressful for a few hours.
Yes, and I remember speaking to you about it, and you know, it's a really stressful time, isn't it, when you're thinking something's wrong with my baby. And you know, although these tests are obviously beneficial in some areas, they have a flip side to them as well, and that was one of the examples. But from that moment, then obviously things started to get back on track. And did you have any
Exactly. No, and then after that, I went up for a final scan just to check everything was fine, and there even the fluid in the kidneys had gone, and the same doctor told me, look, there's nothing else to worry about now. And she also realized that it's not an easy position for them to be in, because they don't want to worry us, but at the same time it's the nature of the scan that you're going to be worried the moment you walk in. So in a way it's reassuring when everything's going fine, but you still get worried if there's a tiny thing out of 100 things that could go wrong. There's one thing that's not exactly the right measure, and so you start worrying. But with the distance, I thought I'm not sure I would do so many scans again, but it's still nice when you know everything's going fine. So.
Brilliant. And the rest of the pregnancy, have you had any other challenges?
So I had a bit of back pain, which you helped me also, and with the sacroiliac joint at the back, so each time I move around or I have to carry my 2 other children, it's a bit of a challenge, but I mean, it's all part of the fun.
Well, I'm hoping that we can do a little treatment on you today and just explain a few things as we do it. Are you okay for that?
Yeah, that would be great. It's been helping me a lot all through the pregnancy, so another one before it comes. Just looking forward to see the baby.
Brilliant. Okay. Well, should we do that treatment?
Great. Let's do that.